Friday, January 6th. It must be time for another legislative update from your North Carolina Medical Society. We're recording this a little early because it's a new year. There's been a lot of action, and there's some big news that we need to talk to you about today. And things could have changed by the time you're viewing this, but we think this is the most up-to-date information. That first big thing that you've seen is Governor Cooper has now been installed as the governor of North Carolina, and in his first action, he was speaking to the North Carolina Chamber yesterday on Wednesday, and he announced that his first initiative is to move for a state plan amendment to North Carolina Medicaid. Now what that means is that on Friday he intends to send a state plan amendment, which is an adjustment to our current state plan, the negotiated contract with the federal government, to expand Medicaid in North Carolina. Now in 2011 in budget language, and 2013 in codified language, the North Carolina General Assembly said that that may not be done without their express authority. So there is some discussion right now about whether the governor has the authority or whether the state General Assembly has the authority to have expansion occur in the state of North Carolina. And that discussion is going to fall into the courts now as well as into the political arena. So we're not really sure when that's going to settle out. We just know that one of our top priorities, expansion of care, access to care for North Carolinians, is in the news, it's in debate, it's something that we're paying very close attention to. Many of you have expressed your opinions about whether expansion should occur or not to your legislators through our avenues in the past, and now to the governor as well. So we're going to be paying very close attention to this and watching how it plays out. We expect that a court challenge will be filed very quickly by Governor Cooper to try to clarify that he has authority in his mind about being able to do this. We expect a challenge will come very quickly from the General Assembly that they have the authority. So like I said, it's going to be something that's going to take some time to work out. This is not something that's going to happen quickly. Don't expect that suddenly we're going to have 500,000 new Medicaid expansion patients coming into your offices in just a few months. We'll be keeping you up to date on a weekly basis on this, because this is something that will be dynamic, and we'll be making sure that you're informed and kept up on ways that you can engage in this conversation, because we know it's been a priority for you. The second big news of the week is the judicial announcement by the three-panel judge about the redistricting process that was laid out. Remember, I told you in December that we were going to be looking at newly drawn districts having to be approved during this General Assembly's legislative session that starts next week. And those new districts were then going to have to run for elected office not in 2018, but in 2017, because all the newly drawn districts, the legislators that are sitting in any of those newly drawn districts, are automatically going to be changed from 2-year terms to 1-year terms as soon as those maps are approved. The state legislature said that that was too burdensome, that it was going to impact the citizens. It was going to be a problem for the citizens of the state of North Carolina, and the three-judge panel disagreed with them, and yesterday announced that no, the districts have to be drawn and the elections have to go forward. So this is a reminder that that can still be appealed, that we can still have that conversation going on for a couple of months, just like we're going to have the courts discussing the expansion possibility for the next couple of months. But we have to be prepared to participate in elections in 2017 instead of 2018. So that same ask that I talked to you about doubling down in December is still applicable today. We need people to be participating and getting ready for those elections because we will have friends, we will have challengers that are running for state office, and if you want people that are open to hearing your thoughts on all different topics related to health care, then we need to be active in the political process and helping them not only in 2018 but also in 2017. The last thing, which was what this Bowtie briefing was going to be about today, is the fact that we are starting the long session next week. And I know that you feel like, as I do, that we've been in session an awful lot lately, but this is the traditional start of the 2017 long session. It will begin next Wednesday, January the 11th, with all the ceremonial normal process that occurs. They'll come in and adopt rules. They'll elect new leaders. We expect that Representative Tim Moore will be named as Speaker, and Senator Phil Berger will be named as the President Pro Tem of the Senate. So we don't expect any big challenges there, any big surprises there. But then we do expect them to basically work in skeleton session for the first couple of weeks. So next week when we talk to you on this legislative briefing, we're going to give you a way to introduce yourselves to the new legislators that have all been brought in this new session that have won their elections in November and will now be named to the 2017 General Assembly. We're going to give you a way to start that conversation with them through email or phone call, to open yourself up to be an expert on healthcare issues to them, to offer yourself as a resource and be ready to answer questions and give your input on the various issues that will be coming up in the 2017 session. We have similar priorities to those that you have heard us talk about for years and years before. Medicaid and Medicaid reform is a top priority for us. And we're going to be working hard to make sure that we are instrumental in forming physician-led, sustainable, high-quality Medicaid offerings to the citizens of the state of North Carolina that need help from the state. We're going to make sure that we're speaking about expansion and the possibility of access to care for those who can't afford to buy it themselves. We're going to make sure that we're defending scope of practice and that we're figuring out how to work in healthcare teams as we need to do under all the new healthcare transformation that's occurring, but that we're also making sure that those people that are on the healthcare teams have the proper education and the proper training to facilitate the role that they are playing in that team. We're going to make sure that tort reform stays strong, and we're going to assist our friends who want to consider other changes to the tort system to improve your opportunity to work with your patients without fear of being constantly barraged by lawyers looking for some kind of solution from you. And then we're also going to, again, work diligently on a solution to this opioid epidemic. And we realize that there are many, many different facets to this challenge and many, many different people and organizations that need to be involved, but you need to be a part of the greater solution. And we've already had some really great conversations with doctors from across the state who are working in their practices to update the way they care for their patients on a regular basis. So we're going to be communicating that and asking you to help us communicate that to legislators to make sure that they don't impose more rigid expectations and statutes, laws on you as a result of them not understanding what it is that you're doing for your patients already. So all that's to say is we've got a big year ahead. A lot is going to be happening. And I look forward to talking to you on a weekly basis. We look forward to making sure that you have opportunities, and we expect that you're going to be participating in the conversation with your legislators on a regular basis so that they know that it's not just myself and the others from here in the Raleigh office that go down and talk to them on a regular basis that are paying attention, but you're back home paying attention also. So we hope you have a great weekend. I hope you enjoy the snow if it actually turns out to be snow, or if it's ice, you stay safe. And we'll talk to you next week after we've cranked up this new General Assembly session. Have a great weekend.